Oh, hello and welcome, future Dolphins. Congratulations on your recent admission to our school. My name is Kobe, and with me I have my co-host May. I am a third year here at CSU Channel Islands. May, if you want to introduce yourself real quick.
Hi everyone, my name is May. I am currently a fourth year and I am double majoring in nursing and health science.
All right, awesome. So today we will be highlighting health science, and here with us today we have Dr. Sonsoles de la Calle from the Health Science Department here
Hello.
at CSU Channel Islands. Hello, Dr. Lacalle. How are you?
Good, very good. Thank you.
Thank you so much for joining us today. Before we get started, please introduce yourself and tell us a little bit about the health science program.
All right. So, as you've said, my name is González de la Calle. I come originally from Spain, and I won't introduce myself too much because the school just published an article, so some of you still see my face on the first page. So you can probably read more than you ever wanted to know about that, about my background. But I have an MD and a PhD, and I am a neuroscientist by training. I love the brain, and that's what I have been working for many, many years, too many to count. And I'm very happy to report, and this is news, that as of last week, we got another manuscript with a research project accepted for publication in the Journal of Gerontology, because I'm very interested in aging and the nervous system. So,
All right, awesome.
okay,
Thank you.
so you said something about the program.
Oh, yeah. Tell us a little bit about the health science program if you can.
Okay. So this is my second year at CI. Let me preface that. So and the program actually started under the umbrella of nursing. In part of that is because nursing programs here and everywhere in the country are impacted, and they cannot accept as many students as want to get in. So the university thought it was a good idea to generate another bachelor's degree that would accommodate the rest of the students and kind of brought them along in ways that could be also useful for them. So, it's a pity to kind of waste their time. But over time, we have a large program. I think there are over 700 students, which is a lot. We are the third or fourth largest in the university. So we are trying little by little to give it a little bit more of a personality, not just a holding place for potential nursing students to continue their studies, but also explore other opportunities, because sometimes we find that students consider careers that they are familiar with. And most of us are familiar with the work of nurses and doctors because, our parents bring us to the doctor's office as kids, and you may be happy to or lucky to encounter a nurse that plays with you, and then that kind of creates a much more closer relationship. But the field of healthcare is very, very, very broad. And in reality, if you consider it as what can I myself do to contribute to improve the healing, the well-being, the wellness, the lack of disease of those around me, the possibilities are endless. So we would like to really offer an opportunity to students to explore those opportunities. And I'll say this too, even though it's a little bit daring, but I would like my like utmost desire would be to encourage students to find new and original ways to discover new approaches to healing, new approaches to healthcare, new approaches to serving their community. That would be the best if we could encourage them to do that.
Awesome. Great answer. You're inspiring me. Wow. You're sending shivers down my spine. Thank you.
Kobe, I kind of own you, remember?
All right, so we're going to go into the first question, and the first question being, what are the most popular courses, minors, and options within the health science major?
That's a trick question, and it doesn't apply to us really, because we don't have minors. We only have one major, and there's just one single track right now. So in fact, whoever is listening to this, I would love to hear back from people if they have ideas of what specializations they would like. But right now we offer a generic approach if you wish. And we have as you know, any bachelor's degree is 120 units or credits. And our program does not take up all 120. There are like about 4 or 5 free electives that contribute to the major electives to give you an opportunity to tailor your studies to what you want to do in the future. So if you look at on our website, we have the 4-year planning. And if you look at that, you'll see that those free electives are kicked to the end, mostly senior year. And there is a reason for that, because hopefully by then, you know what you want to do, even though it's a balance, because it may not be that simple to get into the classes you want, but hopefully it will work. So, so right now that's where we are. And all the classes in a sense are favorites because they are all required. So we don't have any options other than the electives. And there are a few of those. We have a pretty popular one, which is health law. Much to our surprise, there was so much demand that this semester we are offering 2 sections of that one. And we have other classes that have to do with aging and electronic records, health education. So there are quite a number of electives. And then we, of course, take also as electives some courses from other programs that provide like a broader approach to health science.
Yeah, I know I have taken a couple of those electives, and it really broadened my perspective on health science, and I really enjoyed all those classes. So, you know, I really appreciate that you have made these classes and like offer them. They're they're really fun classes. I really appreciate it, and I learned a lot from them.
That's great. I had a student that took one time a class, let me remember the story. She needed an elective and I worked with her to find, and it was a class on botany. And so at the end of the class, I shoot an email to her saying, how did you like the class? Tell me something, is it worth it or not? And she said, oh, I learned a lot about using plants and herbs in healing. So it was really worth it. And I didn't expect that. So that was great.
Well, hopefully, you know, there could be more variety as well as the program continues to grow.
Absolutely.
So,
yeah, we want to hear from you guys what other things you'd like to hear, so that will give us food for thought.
Of course. So our next question is there any type of academic background that a student should have to enter the major?
No, none whatsoever. There is no required background, though. If there is anybody still in high school listening to me, I would please encourage you to take a chemistry class. And chemistry is many times seen as one of those gatekeepers, that's hard class and whatever. You know, disregard what people say. It's really worth taking the class because chemistry is very structured. So even if you hate it, even if you don't do very well, just going through the motions and doing the effort to do the work will help train your brain. So you'll be in a better place afterwards. And I've heard that over and over and over from my students. It's fascinating how, you know, one thing is that I say that, and I didn't particularly like chemistry going into the sciences, but I recognize that we need it, and we need it for health because our body in the end is almost pure chemistry, not completely, but almost. So we need that chemistry to understand physiology, to understand pathology, to understand pharmacology, to understand also environmental impacts, toxins, all those things. So don't shy away from that. And if you can take, we require Chem 110, and that's the only chemistry class we require, which is really, really, really little. But it is very important to take that class because Chem 110 was designed as a survey course that explores general chemistry, organic chemistry, and biochemistry. And most of the other courses that are at the lower division, at the lower level in other colleges, they offer introductory courses to chemistry, but they don't have that breadth. So sometimes students look at me because I say, no, I can't substitute that class. I'm very, very picky. I want you to really have that exposure to the whole thing.
All right, awesome, wonderful answer. So the next question we're going to go into is, what are the opportunities to participate in hands-on learning in the majors? So for example, things like undergraduate research, internships and or service learning.
Internships, we have not managed to have reliable access ourselves, but through the Career Center and through the Multicultural Center, there are opportunities. But we have a service learning class. And actually, for all of you entering now, you have a requirement in the major, which is fulfilled at the senior level, which is you can take either the so-called senior capstone class, which is Health 499, or you can take the service learning class, which is 492. So the 4 in the numbers indicates is upper level, upper division. So we hope, we expect you to take that as a senior, not before. And those two classes are two ways of do like a culminating exercise that helps you put together everything you've learned through the bachelor's degree into a project that is as close to reality as possible. So even the 499 one that is more research oriented, it's still very practical, it's very real. But the 492, you're working with a community partner. Unfortunately, it's harder to have enough spots for that just because the way it's run doesn't allow to have large numbers of people, but it works very well. So just to give you an idea, when was it? Last spring, I taught for the first time 499. And what we did in class, because instructors, we do have some leeway to how we organize our content, right? So we did a lot of stuff that has to do with the real working life. Like I literally made them do the resume, and they learn to critique one another, and we explore interpersonal relationships in the workplace and teamwork and a lot of stuff. But the second half of the class, they were put in groups, and I chose the groups on purpose so that way, to the best of my ability, there were no cliques, so people didn't know each other. So they were like in the real work situation. You go to work to a place, you don't know who you're going to encounter, right? So that was a good practice. But what they had to do, the assigned project was design an improvement to CI's physical education center. So what would you do with the current gym? How would you change it to meet the needs, the health needs of the community? And it was a lot of fun going through the exercise. They did an awesome job. So it's, in that regards, it's pretty real. Right now we have 3 groups of students working on 492, and they are working with the food bank. Is it Ventura Food Pantry, I think it's called technically. So they are working with them. They were desperate for help. What else? And then, I don't know, I get a fair number. I wish I would get more, but I get a fair number of requests for letters of support or just emails guaranteeing that they are really legit students, for students that are applying to internships in different places. So I'm very glad that our majors are moving, getting hands-on experience.
So I had a question about the service learning opportunities. So is it a class structured where the whole class as a group volunteers at a location, or can a student get to pick whatever location they actually want to work at?
It's a structured class. Yeah, it is 3 credits. So it used to be 1 to 2, and it used to be more like self-organized. But that is it's harder if we do that. It's harder to help the students grow in their professional relationships. So we kind of changed it into a 3 credit class. Also, that way it weights the same as the capstone, and it has more structure to it to make sure that we can really help the students meet the learning objectives of the class. Yeah, So usually the instructors for the class take the initiative of finding their partners because they find people that and organizations that are willing to meet also our requirements, basically. The last thing I want is for someone to volunteer at a place and just be filing papers.
Mm-hmm.
That just wouldn't cut it. So, and of course, if you volunteer for an outfit, you are there to do whatever they need, but that doesn't meet my educational mindset. I mean, I want you guys to really do something different than that. So that's why we kind of turn it into a more structured one.
Okay. So our next question is, what type of jobs or careers do graduate students kind of look for or gear towards after graduating?
I think a large percent are looking at careers in nursing, and I hear them applying to the Bridge program and going into the master's level nursing careers. But then I've seen people going in and applying because I've been writing letters of recommendation for PA school. I know that there are people interested in physical therapy, in occupational therapy. There are some interested in the Masters in Public Health and moving into the public health arena. And I've also had questions from students interested in health administration. A couple have talked about health electronic records, which is an up-and-coming career too, with a lot of potential and a lot of need and demand. And then a few working in health education also, like working with community organizations or even as the patient service arm of hospitals and other health centers. So those are the things that I hear most. I also contributed to 2 students have so far asked me for letters of support to go into medical school. One was a physical trainer, a personal trainer, and he wanted to go into sports medicine, so he applied to osteopathic medical schools. And the other one is very interested in research, so he's applying to an MD programs with a research component. So it's a huge variety, and that's just the surface. There is more over there.
All right, awesome. So in that answer, you're actually talking about how people can branch off and go to different things. Some get a job, some go to graduate school, obviously. But how does the health science program prepare students for graduate school?
By harassing all of you like there is no tomorrow, and really, really, really working you out, trying to make sure that you get the best education you can. I think the most important thing to go to grad school is acquiring rigor. So this may sound weird, but we are very, very big on not tolerating any academic dishonesty. Then we also have a very intense ethics class that prepares people to understand exactly what they're getting into. But I think mostly rigor. So critical thinking, the ability to reflect on data, the ability to find sources and identify which sources are reliable, which ones are not, be able to make the connections between different areas of health, how they talk and interact with one another, how individual health is, in a sense, dependent on community health and vice versa. So those are some of the ideas that we collectively have underlined the way we teach to make sure that the students get very well prepared. Because in the end, going to grad school is, you have to go into the process with a show-off mentality, because you have to come across like you are the best person for the job. So the admissions committee will take you. So in several of the 499 classes, we've been practicing on making sure that at least you get 1 time opportunity to go through how do you make your resume, how do you tailor a resume to a graduate program versus a resume for a job, because they're very different. And that gives, I'm hoping that it gives your colleagues an opportunity to see where their holes may be in the resume and make decisions. They still have time. You know, if you want to go into a career in healthcare and you've never volunteered in a health clinic, then you know you need to do that first, because anybody that is going to interview you wants to know, do you really know what you're getting into? So things like that. We don't have a health careers advisement office per se, but I'm kind of giving some thought to that and tempted to propose to the dean that we create one of these offices under the health science department, because I think it would be a great benefit to all the students, but that's still in my head, not anywhere else.
Well, I do hope that that comes out of your head and comes to fruition, because I think, like you said, health science is very popular major at our campus, and I think that would be a great resource for our students to look to.
Yeah.
So here, do you have any general advice, maybe not specifically health science, to any new students starting their studies at CSU Channel Islands?
I am very opinionated. I always have a lot to say. So that's a danger to ask me that question and go on forever. Well, I think, okay, first of all, don't come with fear. We don't bite, okay? And come and talk to us, faculty, as soon as possible. And if you are reluctant to do so, more of a reason to do it, because you've got to kind of train yourself. Then remember that you are in school to try new things, and you are also in an environment where you can afford to fail, because there are no stakes. It's a low level failure. So don't be afraid of trying things and getting into things that may be a little bit over your head, because we don't count that against you. And instead, you get experiences that make you grow as a person, as a student, as a professional. So don't be scared of doing that. Then just remember that the hardest things are the ones that are the things that will really make you happier later, because it's an accomplishment. Make sure that you have a balanced approach to life, that you have time to exercise or play sports, that you have time for social life, that you go out with your friends, and then that you have that also you have time to read, to enrich your interests in other ways, maybe have a hobby or 2 or 10, well, 10 maybe is too much, but 1 or 2 is good. And then of course, time for your academics, and that you go and dig deeper. So your mantra should be, I must dig deeper, because that's your opportunity to do that. So this semester, for example, I had, well, last semester I was talking over Zoom with one of your colleagues, another health science student, and we were doing advisement and just looking at options for career and things like that. So she told me, just by chance, that she had discovered this software called Airtable that had made her life much more easier. So I'm like, oh, you are coming to present to the class. So the first session now in the spring in my class, she came in and presented to the class how she had done it, and it's a fascinating tool. So I think that we have to be very creative in learning, even though there's a learning curve, but learning the electronic tools that will make your life better. She was very funny because she said that she loves binging on Netflix, but she always had at the back of her mind, oh, I need to do homework. So the reason she did this program is because it entered into a database everything that she had to do for the whole semester. So then she knew by day what she had to accomplish. So once you know what you have to do by day, then you also know how much time you have for Netflix. That was her explanation. I totally buy it. I was fascinated. So I think that planning and buy a planner or something, get yourself organized, ask questions, ask tons of questions. Those will be some of the things I would suggest students to do.
All right.
What you wanted to hear.
All right. So I know you haven't been here at CSUCI for too long, but I feel like you've been here long enough to give your opinion on what is your favorite class to teach here.
Well, I enjoy almost anything, to be honest, which is a curse actually. But so far, I've taught the capstone and a class on ethics. And the class on ethics was hard to teach because I didn't know where the students were coming from. But that is a topic that I am also particularly, as a physician, I'm very, very interested in teaching. And this semester, I am teaching a makeup class. It's actually called independent research, but it's not independent research. It's actually independent research on what careers in health science are. So we kind of made it up a little bit just to provide some people with resources and ideas. And we have guest speakers every week coming in to listen, to present about their work. They present about their personal experience, their academic trajectories, how they got where they are, and then a lot of stories about their patients or their workplace, just to provide ideas. And that is proving to be a fun class to have. So basic answer is I don't know which one I like best. Sorry.
And do you know, are there any clubs that students can join? Anything related to health science?
Yes, there is definitely, there's a nursing one, there is a PA one. I don't know who's running it now because the president was a biology student that went into PA. And now that we don't have, we don't have the opportunity to go and meet by the table, there is also a public health one and that I know of. So those are some of the clubs. But again, the sky's the limit. So people hopefully come with ideas. There should be one about a club on wellness and physical training. So.
And is there any last things that you wanted to let our students know?
We love having you over. Just make sure that you make yourself known. Sometimes it's like blank faces. You don't read. So come and talk to us. Again, we love to hear from the students. There is more than meets the eye. Sometimes also the faculty have research projects that they would like to engage the students with. So, we don't expect you to know everything. If you knew everything, you wouldn't be here. So come over and meet us. Take the initiative. Yeah.
Thank you so much, Dr. Sonsoles. Students, if you have any more questions about the health science program, please visit go.csuci.edu/academics. Bye, and we hope to see you in the fall.
Bye.